Good afternoon. My name is Christopher Morphew, and I am the Dean of the Johns Hopkins School of Education. I want to welcome all of you to the fourth in a five-part webinar series we're calling Impossible or Imperative. Our topic for today is Voices of Experience, Real School Practices During a Pandemic. For some background on the topic and what we're going to be discussing today, let's take a look at some of the wide-ranging challenges and that students, teachers, staff, and school leaders, like the three we're going to be speaking with today, are facing right now as we head back to school. Again, welcome to our discussion on real school practices during a pandemic. As I mentioned earlier, this is the fourth in a five-part webinar series we're doing on reopening schools during the COVID-19 crisis. In previous sessions, we've explored a number of topics, issues like equity, social-emotional learning, and how COVID-19 might offer us an opportunity to rethink educational policy. Today, we're going to be digging into real world and real school practices, the incredibly tough work that schools are undertaking as they fulfill their educational mission amidst an almost impossible, and some might say impossible, set of expectations. As our nation's students and families encounter that educational landscape, one that is technology dependent and vulnerable to growing inequity, what can our schools do and our school leaders do to improve teaching and learning, ensure access, support students' social emotional health, and build stronger partnerships with families and communities? Today, we've invited and we've secured a great panel, several of the nation's top experts in school and district leadership, representing urban, suburban, and rural areas, as well as the critical role of special education. And they're on hand with us today to discuss real school practices during a pandemic. Let me start out by introducing our panelists. Dr. Sonia Santelises is CEO of Baltimore City Public Schools, an urban district of almost 80,000 students. She has served as Vice President for K-12 Policy and Practice at the Education Trust and as an Assistant Superintendent for a network of 23 pilot schools in Boston. She's also been a Senior Associate with Focus on Results, where she's coached school leaders in major urban districts. Thank you for being here, Sonia. Next is Aaron Parsons. Aaron is Vice President of School Programs for the Kennedy Krieger Institute here in Baltimore. He oversees several of the Institute's school programs, as well as admissions, regulatory compliance and transition services, as well as psychological and behavioral sciences. Dr. Parsons is certified as a superintendent of schools and has served in public policy as a public policy chair for the National Association of Private Special Education Centers. Aaron, thank you for joining us today as well. Finally, Sharon Contreras is superintendent of the Guilford County Schools in North Carolina, a system with more than 73,000 students. Dr. Contreras has served as a principal, area superintendent, assistant superintendent, and chief academic officer in 5 different states and was superintendent of the Syracuse City School District in New York State. She is a member of Chiefs for Change, Education Leaders of Color, and is the founding co-chair of the Council of the Great City Schools Task Force on Black and Latina Young Women and Girls. Thank you for being here, Sharon. And to our audience who's joining us, thank you all for being here. Let me give you a few guidelines about our discussion. We're going to try to make this as interesting and interactive as possible. I'm going to start out by asking each of the panelists one question to get things started. Then I'll be directing a series of prepared and reactive questions to the entire group. We want you to join in, and these virtual webinars allow that allow that pretty easily. You can submit questions by pressing on the Q&A button at the bottom of your screen, and there'll be a chance for you to upvote, if you will, the questions that you see posed by other audience members, so we can try to get to the most popular questions as soon as possible. And we'll start with audience questions about 20 or 30 minutes into the discussion, and we'll get to as many of those as possible. So again, welcome to the audience, welcome to the panelists, and let's get started. Sharon Contreras, let's begin with you. In my introduction, I mentioned that you're a leader of one of the nation's largest districts. Your district spans urban, rural, and suburban, and it obviously includes a broad range of programs and types of students. And as superintendent of the Guilford County Schools, serving more than 73,000 students, you are surely encouraging a lot of urgent issues all at once. So what have been the most serious concerns that you've seen as schools have reopened? And how do you prioritize? How do you triage in this situation?
Thank you again for having me. Since the beginning of the pandemic, public schools have been faced with a convergence of issues, educational and social crises, including lack of technology, denying the most vulnerable students in education, student family lack of access to high-speed internet connectivity, lack of educator preparation to teach virtually, inadequate resources to deal with the massive social emotional needs of students, many of which were exacerbated by the pandemic, like housing and food insecurity, trauma, violence, underemployment or unemployment of parents and caregivers, the resulting substance abuse. We've been faced with dealing with food insecurity and the constant battle with USDA and the administration to maintain summer feeding flexibility so our students and families don't starve. We've been attempting to serve our exceptional children, many of whom aren't served well virtually when we cannot meet in person. All of this as the nation once again comes to grips with our sordid, complex, and painful racial history. And all of this within the context of a deeply divided nation, particularly in county school districts where you have rural, suburban, urban, and urban communities and parents and community members across the political spectrum. So I asked myself the same thing: how do you prioritize? You actually have to do it all because we simply have to. Students have to eat, students have to learn, students have to come out of this physically and emotionally whole, and we stand in the gap for them. We are their voice until they find their own, and we fight for them. But my most serious concerns center on our most vulnerable student populations, those students who are facing inequities prior to school closure, and those students who may never recover from learning loss experienced during this time.
Thank you. Sonia Zantalisas, I'd like to follow up with you on that. Nice segue here. You're the CEO of Baltimore City Schools, which is a large urban district, almost 80,000 students. A couple of weeks ago in one of these webinars, we focused the entire session on equity. Obviously, Dr. Contreras was just pointing to these issues on equity as well. Baltimore City Schools district is 76% African-American. How are the issues around equity and racial justice playing out in Baltimore City right now?
Well, I think, first let me just say, I think I would agree with everything Dr. Contreras said with regards to having to do it all and the context we find ourselves in. Within an urban school district, I think where we have found ourselves in Baltimore City is that the continuation of equity issues that, Chris, we really had not resolved post Freddie Gray as the kind of latest eruption of racial unrest and disproportionate investment within our city. We have a legacy of redlining that has had long-term impact up until today. And I think that, as Dr. Contreras pointed out, it has not stopped what school systems are being asked to do or what we know needs to be done. I think within Baltimore City, there is this balance, and I think it is an equity balance, trying to hold the safety of communities, the actual health and well-being of communities within an environment of historic underinvestment, right? So you have work that's been documented, and we're not the only urban school district that faces this, but you're talking about a safe return to school buildings, and it's something you all know at Hopkins because you've been diving into this. But when you talk about health, you've got to hold physical health, meaning how safe is it to actually physically be back in certain buildings. So in our 21st century buildings where we have up-to-date air filtration systems and greater access to spaces that are more conducive to learning, period, those are the spaces that are easier to think about opening more safely. When you look at school buildings that don't, there is added cost even in consideration of reopening. So you take a school building that does not have air conditioning, that has challenging circulation. Well, even within the CDC guidelines, no disrespect, those were insufficient in addressing the conditions that you find in under-resourced buildings. So what did that look like? It looks like the school district now needing to invest in air purifiers, right? Which is an added expense because as kind of our joint health consultation panel, like they had to deal with those requirements in an environment that already was not where it physically should be. And so you've got this compounding on physical health at the same time that you have families who are, many of whom are the frontline workers who frankly never stopped working through this pandemic. They were the first responders. They were a lot of the frontline folks in a city that already has challenging transportation, right? And so you compound that on the fact that a lot of these families, it was not uniform. And I don't have the similar challenges of diversity of a county system the way that Dr. Contreras does. And there are some days I am thankful for that, quite frankly. But then what it does mean is, for example, you have disproportionate health impact on folks of color, and that's bearing out in the health data and families' willingness to try to come in at the same time that you have families who have real physical need for their young people to be in school with some kind of supervision. And so you have to talk about the midway points. And then there's just mental health. There's mental and physical health of young people in addition to any kind of academic learning loss we're having. And so we had 200 students who came to in-person virtual, not in-person virtual, but in-person summer school, which was not thousands, but what we heard from those families was actually our children need interaction. They have been caught at home, oftentimes already in challenging situations. And so their mental health, their state of being, how they feel, and then in a lot of cases, physical safety. And so when you're talking about families and communities that are already under-resourced, on every level of reopening, you've got exponential considerations that are only just reinforcing the equity questions that were there to begin with.
Thank you. Incredibly challenging descriptions, and I know that's what's happening on the ground. Another aspect of equity, I wanted to direct a question to Erin Parsons. It's your turn here. When I introduced you, I mentioned your role at Kennedy Krieger, Vice President Kennedy Krieger, and your large regional special education provider. Another aspect of equity, of course, is special education. 7 million children in public schools receive special education service. That number is growing. How are schools managing to support these students and provide these vital services in the midst of a pandemic and all of the resultant challenges?
Well, thanks, Chris. First, I want to say I really appreciate and agree with the perspectives that have been shared. I want to give a little context to my responses beyond my role at Kennedy Krieger Institute. part of a national association of private special education schools. There are over 200. We're in 44 states. Those schools are partners with the local school systems. Many of them are serving publicly funded students. So speaking from an experience that's broader than my own particular program, also here in Maryland, there's an association of non-public schools serving special education students. These are the students who demonstrate some of the most significant need for individualized services. Of course, drilling down into Kennedy Krieger, we are a research rehabilitation hospital. We do have exceptionally deep clinical experience, and that's something that I'm really fortunate to be able to draw upon in our special education. So although Kennedy Krieger Institute is certainly recognized nationally, I think that the existence of these other non-public schools partners to the local school systems is not well established. It's not well known, and it's something that I do like to draw attention to. I can say that our experience initially is that we saw success with the use of technology and the delivery of special education services, but it was limited. Again, special education students, we speak about it as if it's a single group of students, but as we all know, there's multiple demographic important indicators across those groups, some related to their special education needs and others that are not. Technology was the key here, not only technology, but the access to technology and connectivity. That was something that was highly variable. And while we did have students who are participating nationally, of course, we had many who were unable to due to the technology, but also significantly, we mentioned this earlier, the need for parental support. We really can't deliver individualized special education services without an adult present to assist that child. So that's been a very difficult experience for our parents and for our students. I think speaking for Kennedy, we were able to draw upon experience with the delivery of telehealth services, which quickly stood up our delivery of related services. And I have to say that's been successful. It's been innovative. We've seen a lot of participation by parents, which has been beneficial. But I do have to say again to emphasize that some of our students have been participating fully, and we've really been encouraged through the use of these virtual tools. Others have been able to partially participate, but we've seen many, both within our own programming and nationally, who've really been unable to participate, in that virtual environment. And that just speaks to the need of really that there is no substitute for in-person instruction and the delivery of related service. So while I can really, sing the praises of technology, we're using 2 platforms, 260 different applications across, hundreds of devices. That success is limited. And I don't think that we should see that this is completely successful, but rather the most effective intervention that we had at hand.
So Sonia, building on what Aaron was just talking about in terms of technology partnerships, let me come back to you and say, when you look at what's happening in BCPS right now, Baltimore City, are there emerging practices related to technology and or partnerships that have really helped support the resilience that you're seeing in city schools? What seems to be paying off for you right now?
Yeah, I think I was actually speaking with somebody earlier today, Dean Morphy or Chris, if I can just say that. I was speaking to someone earlier today who asked me about kind of the pockets of promise that actually are revealing themselves in this time. I would say one, in the early days of this crisis, the fact that we had curriculum partners and assessment partners who really did take some of the initial lift to be able to translate some of those lessons online. And we were able to do that because of some of the curriculum work we had done earlier. And I think part of what that has led to is, as Erin was sharing, an understanding that that's never going to completely take the place of an in-person interaction between students and adults, right? That relationship building. But what we did hear feedback from both teachers and families was it was an additional support, like having recorded lessons was an additional support that they had never really had access to. And for a lot of families, was actually far more accessible through cable television or recordings than even, frankly, trying to maneuver 5 or 6 different online platforms. So that's one thing. The second piece, which I think we're really trying to lift, is what happened in the spring and that we continued through part of the summer that we're hoping to also build on in the fall of what does it look like when you actually change teacher roles in a virtual environment. So the ability to take teachers who frankly are just very skilled in how you set a lesson, what we continually, or what we traditionally kind of think of as the upfront framing, direct teach of content, and what that means when you go from just your 15 or 18 students to through technology reaching at one point 5th grade math students across 10 schools, right? And then other teachers being able to then focus on the kind of differentiation that we often talk about, but we know is lacking in practice on the ground, became a lot easier, right, to do when I, as a teacher who frankly might not be as strong or not as comfortable doing upfront online or otherwise, now I can come and actually really focus on the individualized needs of different groups. And that kind of push on traditional notions of roles. And then finally, I would say just the access to coursework that we talk about at the high school and secondary level. We were able, with the University of Baltimore, to bring some of our incarcerated students at Eager Street Academy college level courses. And quite frankly, they did incredibly well. And some of them, being very direct, told us that it was the most rigorous learning experience they had throughout their K-12, their K-12 career as students. And so building on that, we're partnering with BARD, both college and early college, to bring new coursework. Like, for example, one of the courses that will get college level credit that was developed for our young people, not in our advanced, our entrance criteria schools, but actually the broad swath of our schools that traditionally people don't think of as having that kind of access. Now we'll have 2 courses for college credit. One being Black in Baltimore. And so, that being, a serious course that is responsive to what we heard from our young people and is not reliant on every teacher at every high school now teaching that course, but it will be virtually taught with both, university level faculty as well as high school level faculty, and have much broader access than we might have traditionally thought of. So I do think that technology has given us permission and frankly cover to do some things that previously, because of seat time requirements and just our own frankly mental hangups, we just did not take advantage of, that I think we're pushing a bit more on now.
Yeah, I think that's an incredibly important point, and I want to come back to that question to you, Sharon, in just a second. But I also want to remind our audience, we're about 25 minutes into this, so in a few minutes we're going to be able to get to your questions. So please submit your questions, and if you see a question that you think you really like to see asked of the panelists or a specific panelist, upvote and let us know that you'd like us to get to it. But let me come back to you, Sharon, and build and connect to what Sonia was just saying, what Erin was saying beforehand. This sort of necessity is the mother of invention, right? And in Guilford County, for example, I suspect there are some things that you had planned to do that you're seeing work out very well. And I suspect there are some things that you hadn't planned to do, that you've been forced to do, that you're seeing actually pay some dividends. Could you talk a little bit about sort of that planning and that also seat of your pants, invention and innovation you're probably engaged in, and where you see that working and being more promising than you might have expected?
Absolutely. So first, I just want to share some of the things you are going to hear are very similar. And that's because Sonia and I talk quite a bit about how to proceed with this work, because there's no one who's done it before. So we have to depend on one another a great deal. And we learn by trial and error. So, you know, we walked into this and I learned I only had 16,000 devices in a district for 73,000 students. That's after years of underfunding public schools. We learned we had very little technology. I also know I hired 300 to 500 brand new teachers. Most of them do not come from schools of education. There are some very loose rules that could work for us or against us in the state of North Carolina, but it allows us to hire degreed individuals, and over time they can earn their teacher licensure. So I thought about this and I said, here's an opportunity to expand the reach of great teachers to many students while also exposing our newest teachers to some of the best teachers in the district through the use of technology and recording lessons. So for the first 3 weeks of school, no teacher was responsible for live teaching. We've heard forever from classroom teachers, we wish we had more time to get to know students, their families, to find out where students are. Well, we did that. We recorded lessons for 3 weeks so that we could do parent-teacher conferences, diagnostic assessments, orientations, and we did this all within the guidelines we've had through the state with social distancing. And students came in, parents came in, much of it was virtual. Nevertheless, the teachers now know the students before they start their teaching. And we use our most highly effective teachers. Some of them are the most highly effective, not only in the district, but in the state, to teach the lessons. They were pre-recorded and the parents could access them at any time. We also, just like in Baltimore City, spent a great deal of time with our incarcerated youth. And we sent, for the first time, Black and Hispanic male teachers into the JDC to make sure these young men, because they are almost exclusively Black and Hispanic males in the JDC, so they had their first exposure in many cases to these African American and Latino male teachers. I heard them say, these young men say, I like math. I can do math. Students who have failed most of their lives said, I can do math 1. And that was so powerful to me. Parents also were tweeting and on Facebook, on social media saying, wow, whoever this first grade teacher is teaching CKLA is so good. I stopped writing my brief just to watch this lesson. So they are being exposed to the outstanding teaching in the district, just as some of our new teachers are. So I think that's been a huge win for us. And it's something I think we will continue in years to come, because I think that every child is entitled to getting to know their teacher, sharing with their teacher what their hopes and dreams are, what their strengths are, what their challenges are before they walk into the classroom. A parent shouldn't learn this at the end of the first 9 weeks. And so this pandemic has provided some opportunities that we did not have in the past. We still are struggling with technology. But there are some wins here for us as we are proceeding through this journey.
And I think that's a really important takeaway. I've got two children in public schools and another one off at college this year. And, you know, my public school has been wrestling. They go to middle school and a high school, and the schools have been wrestling with schedules. And I think one of the things that the pandemic has allowed us to do is to think more creatively about our schedule. It doesn't have to be a, 8:30 to 2:30 move them from class to class to class schedule. Maybe we could take Wednesdays off to do pre-recorded lectures or asynchronous events or other kinds of activities. So I'm really interested listening to you talk about your experiences there and how you've been able to expose parents and the community to some of the sort of best and brightest teachers you have, and maybe mentor some of your younger teachers in the process and give people professional duties that are more aligned to their skill sets, right? What are you best at? Let's put you in front of as many kids as possible. If you're the best at delivering a lecture on X, let's give you that lecture to as many as possible. So that sounds great. Aaron, let me move to you. A lot of the things that we're talking about, a lot of things that we're hearing about from Sonia and Sharon here are sort of innovation, invention, having to figure out where the partners are. The federal government has essentially failed here to pass significant funding for reopening schools or supporting schools beyond the initial CARES funding money, which was not nearly enough. I think any estimate of what schools need has been, exponentially greater than what the CARES funding had come up with. Where are you going right now for resources to meet your schools' needs and your students' needs?
So ours specifically, and of course, again, coming from a non-public perspective, is slightly different. The CARES funding, although I have to point out that Sonia's Office of Grants in Baltimore City does look out for non-public schools and their access to federal funds. So I want to thank her for that consistently. But there's been some confusion about the awarding of CARES grants to non-public schools. The definition federally is overly broad, and I've made a couple of Hill visits to try to get some mutual understanding about distinctions around types of private schools and the students who they serve. As you mentioned, haven't been a lot of leadership wins recently. So there are numbers of schools that serve publicly funded students who are misunderstood to be a private school, somehow highly endowed through parents or donations, funds. That really isn't the case. These are highly complex students referred by, in our case, 14 separate local school systems for service, and their eligibility for these funds was questionable. It's very confusing. There's been several lawsuits launched. I understand that there's concern about protecting public education and not diverting public funds to private schools. I am the product of a public education, very proud to be so. But these are publicly funded students who are being overlooked. So frankly, we're looking to, be creative with our finances. I think other schools around the nation are doing the same, reallocating lines, seeking donors, working with the local school systems for ESSERS and GEARS funds to participate with them. Of course, again, there's without a centralizing leadership component, this has been difficult. And I think that, I have to say that all the districts that we work with, all of them are headed in the student-centered direction, but those directions for non-public can be slightly different. So it can be difficult to coordinate. I definitely think that the fact that there isn't additional funding, CARES funding for schools, let alone non-public schools, that's a major oversight. The amount of infrastructure, facility, innovation that we require is substantial. Sonia mentioned some of the buildings here in the city, but this is a problem nationwide. And I think that the failure to recognize this and the focus on, liability protection for other areas can be a bit discouraging. I do want to stress that I think that we can affect change for this through advocacy, but it's pretty difficult, in this current climate that these funds have become so politicized. So, I think that my constant refrain across the country to these schools and to parents is to get organized and get active and get your message to the Hill. I think that it's easy to be discouraged right now, but we can't stop.
Thanks, Aaron. So Sonia, let me come back to you. We've talked a little bit about facilities. Aaron just mentioned it. You'd mentioned it before. Obviously, you've got some challenging facilities issues in Baltimore City. But let me talk a little bit about how, I'd love to hear your thoughts and what you see happening in the city in terms of using your school buildings and your facilities to meet community needs. How has Baltimore City in rapid high unemployment, community needs, hunger issues, how has the school district used its facilities to meet those community needs?
No, absolutely, Chris. And I think that this is an area that is only going to become more pronounced as this pandemic weighs on and just the overall challenges. So I think like many other districts, including Guilford, we first and foremost continue to serve as major feeding sites within the city. We were fortunate here in Baltimore that we were able to partner with the mayor's office on children and families, as well as rec and parks. And actually, during the first 3 months during the spring, we had about 15 to 18 sites that were open, that were literally just for people to come and get food. We made the decision, like a number of school districts across the country, to not just give children multiple meals before USDA approved it, but we made the call, like many others, that we actually were going to feed adults as well, because I just knew early on. I remember visiting one of our sites and seeing a grandmother who came to a local school, to her grandchildren's local school, who was challenged in walking and had walked 3 or 4 blocks to get there. And, the head of our food nutrition, God bless Liz Marquetta, she was like, so, we're supposed to turn these people away, right? We're only supposed to feed children. And I was like, heck no. Like, are you kidding me? I am not going to have a grandmother walk her grandchildren there knowing she's not eating. So just count up the adult meals and we'll just have to pay those ourselves. We were fortunate that we did get some philanthropic support, but that came out of general operating dollars. The other piece that we're excited about, that again, I know many other school districts are doing as well, is we will in another week or 2 be opening student learning centers. I know this is an area, I think Dr. Contreras, I think Sharon calls them something different in Guilford, but really opening up the school buildings for there to be supervision of students, young people, particularly elementary school students whose parents have to be working. And so partnering with recreation and parks to be able to provide that. And then I think to something that Aaron referenced, we are actually going to target some of those sites, ideally, once they get up and running, to be places where we can begin safely delivering service to some of our most vulnerable young people, right? So we know, I got an email yesterday from a special educator in Baltimore City, a teacher, who just said, Dr. Santelises, this is crazy, right? Like, I have some of my kids who I can't really serve well, even with all of the innovation in virtual space and telemedicine and everything wonderful that I think Aaron was describing. From this teacher's perspective, she said, there are just some of my students who I need to be able to come in and see them. And so part of what we're looking at too is how do we make sure that there's learning going on, there's recreation and parks, we're partnering there. We've also partnered Ideally, at some point, we know testing is challenging, but we've actually offered to some of our schools to be testing sites so that we can then serve the community there, and then also building out some of the mesh networking that we're trying to explore more neighborhood and community-based Wi-Fi. So we really are trying to leverage particularly the state and the city's investment in our newer buildings to really be the hubs that we want them to be. But that's we still have a ways to go with that as well. But I think those are some of the areas that we're really trying to use our buildings to help from a community perspective.
Yeah, the whole idea of a community school has
Yes.
So there are some of us who thought that was sort of a nebulous idea in the past. A lot of schools like to talk about being a community school.
Right.
We're finding out when the rubber meets the road here, what a community school actually is and what it does, right? And
Sure.
I think that's eye-opening to a lot of people, what schools can and should be doing for their communities. Sharon, let me ask you a similar question to what I just asked Sonia, and that is, but maybe with a focus on rural schools. You've got an incredibly diverse district. You're serving urban, suburban, rural areas. What are some of the things you see playing out in rural areas that are maybe akin to what Sonia was just describing, but also different in the way that you've got to respond and some unique challenges there?
Yeah, what I've learned is that the rural areas are very similar in some ways to the urban areas. I had a parent call within the first few weeks of the pandemic and shared that the cable company had informed her that it would cost $23,000 to provide broadband connectivity, high-speed internet to her community, that she just lived in such a rural area. So much of what we heard and saw from cable companies wasn't quite what it seemed in terms of we're doing so much for children and this is free. That was not the experience of our parents, particularly the parents who had previous debt or who lived way out in some very remote areas. And the state and the county had not invested very much into the remote areas. Right now, both UNCG, University of North Carolina, Greensboro, and North Carolina A&T are working with the district, and we together put out an RFP to try to bring low-cost, high-speed internet to homes. But that's not something that the universities and the school districts should be expending its resources on. That's something that the state and the federal government, the FCC, should be doing. And the FCC has billions of dollars at its disposal to ensure that all Americans have access to high-speed internet. And quite frankly, in 2020, that not every family has access to high-speed internet is almost criminal in this country. It should be a public utility. So we, just like Baltimore, we've opened up 24 learning centers, opened 9 to 1. We also have opened up 69 schools on Saturdays as internet hubs to try to address this issue of connectivity so that students can participate in their education. But I can tell you, I am still concerned because in a county that is 650 square miles, even if you open your nearest school, for some children, that's still 4 or 5 miles away from their home in some of the very rural areas of the county. And for an elementary child whose parent is working or doesn't have access to a vehicle, they're not going to let their child just walk that far or depend on someone to go there. So we've tried to provide hotspots. We've deployed 125 smart buses into the community. These smart buses serve as hotspots. But let's just be honest about it. Not one of us on this panel would our children be sitting outside a bus trying to do their homework. We have to do better as a country Unfortunately, the public hasn't put all the pieces together to understand this isn't the school district. So a lot of the blame for these shortcomings are falling upon the districts, the school boards, the superintendents, because we don't understand that this is a major failure at both state and federal level.
Thank you. We've got an audience question that was directed to Dr. Parsons. Aaron, this is from Courtney. Can you share some specific innovations for special education that you have seen arise from this pandemic?
Definitely. And again, part of this is based on our, experience with a telehealth or telemedicine background. We recently just supplied a list of anecdotal information to the Maryland State Department of Education. They just wanted specific examples. So there have been some very simple additions to technology that we found very beneficial. More than a single camera in the student's home for the delivery of certain services could allow the related service provider to monitor the student's motions or activities in a different way. The creation and delivery of materials that are specifically designed for that student, sent to the home setting, and then manipulated at times virtually. Some of this is electronic, some of it is more analog material, but delivered to the home setting, along with what's been really the most critical component, but again, the most difficult and the most taxing, is parent training, because you really have to have the ally in the home. And I say parent, but it could be a guardian, a family friend, an adult, willing and interested. But training delivered to those individuals, that's something that we've done at levels that we had not done in the past. I would also say that, part of what we're experiencing, and this is related to the innovation, is that the innovation is iterative and that it's ongoing. And part of what I see as both success and concern is that as we've moved rapidly to this virtual model, that part of the regulatory response has been the desire to build essentially an analog replica of a classroom that's video-based, that the student can watch it, and there's a set number of synchronous hours. And that what we've found is that one of the best practices, to the extent possible, is the individualized scheduling, the use of recordings. I think a lot of sectors who've suddenly been moved into a new paradigm, they'll often rapidly work to recreate the environment they had in the past. And it doesn't necessarily work as effectively in the new paradigm. So I think the use of video recording technology, which is of course fraught with issues inside special education, the use of telehealth technologies, definitely a major benefit for us. The other thing that we've been really working to implement is the use of virtual one-to-one support, bringing the critical paraprofessionals back into that virtual experience. Scheduling can be very difficult. What we've done is the initial assignments are being implemented by behavior analysts so that we can better design this experience, and then turned over to a paraprofessional with training to try to connect with that student individually and move in to supplement that synchronous and asynchronous experience. So I'd say those are some of the highlights. The other thing is having the ability to mix assistive technology with technology is key. But again, part of what we're mentioning is that basic access remains a problem. So that some of these examples are, they have been surprisingly effective, but in a narrow scope.
Thank you. Thank you. Sonia, we're hearing a lot about the COVID slide, and we had a webinar session couple of weeks ago where we talked about social emotional learning. And frankly, I'm as concerned about the social emotional loss, learning loss, if you will, as I am about the sort of academic learning loss. What are you doing in terms of thinking about that potential learning loss and the social emotional learning loss and planning for that as you come back into hybrid and or physical reopenings?
No, it's a great question, Chris, and it's one that kind of keeps me up at night. Just when I think about kind of our core work around making sure young people have solid relationships, and it's still about learning. I think a couple of things. One, we have deliberately built into the school schedule more explicit time, even in the virtual space, to get better reads on where young people are with regards to just their social emotional health, everything from is there kind of additional challenges that young people are facing in the virtual environment that we would not necessarily be able to see as clearly as oftentimes we do in a physical environment. And let's be clear, we weren't as good as we needed to be even in the physical environment. So I just want to be upfront about that. But we've been a lot more deliberate in building time for that. Specific connections, even through academic content, has been incredibly important. So it's not just, oh, we help you build some of that kind of emotional connection and those social skills only in this 15 minutes a day, right, in your schedule, that it's actually about how the instruction's taking place. What we also saw with our in-person summer program, and learning from a number of colleagues who have started back and have shared kind of what I wish I knew before we started back. One of the things that we've heard is, and we saw in the summer, is bringing students back in smaller groups first to be able to have some of those connections was really valuable. And we heard that it was valuable for families who frankly don't always know whether they should trust a large institution like schools that weren't doing such a hot job, frankly, before the pandemic, that for them it was a trust building exercise, the ability to see, the ability to establish relationships, much more contact with families. So that on the social emotional end, I think the link between that family piece and the academic acceleration that we know needs to happen is building in far more knowledge and information for families about, one, where their young people actually are with regards to a trajectory of learning. And I think we've got to be very deliberate about how we have those conversations. So it's not kind of let me tell you again how far off your child is because of the last 6 months. We have too many families of color, too many families from low income communities that are so used to every narrative being about what their kids lack and not nearly enough about how we're going to move them. But what I have also seen since the spring is the large number of families from every zip code, right? Not just one neighborhood or another, but across the city, who are asking the question, like Dr. S, what do I do to help my child get caught up? And so using some of the technology that's actually in place now so that parents can see in ways that, frankly, teachers were the primary purveyor of that information. Now parents can see which standards are my children at now, and what are the actual exercises, additional time spent in a virtual space with access to experiences that a large number of our families didn't have before we were forced to make this investment in virtual learning. And then I'll just end with saying just kind of a pitch for Dr. Contreras to talk about some of the tutoring work, because frankly, a lot of the ideas we got for ramping up our tutoring capacity actually were sparked by the work that she and her team were doing in Guilford. And the one thing I would say about that is when you talk to families like those of us on this call, When we find out our child is behind in something, we do not talk about keeping them back a grade. We never talk about remediating them and moving them back a class. That never even enters our mind. One of the first things that we talk about is, do we need to get you a tutor? Do you need more time? How do we help you get back on track? And so we actually took a lot of lessons around the tutoring piece. Frankly, we learned from Guilford and a lot of the work they were, I think, out front in doing around that. So I didn't mean to do that past you that deliberately, Dr. Contreras, but well, I do think it is, I think it's one of the things that Guilford was out very early on.
And Sharon, if you could just talk about that for just a minute, but also really quickly, you mentioned, because we're coming up on time here, but you mentioned that you were hiring 300 teachers or so a year. I'd love to hear your thoughts about whether, how you might think differently about who you hire in the future based on what you've learned, as well as this tutoring.
Absolutely. So with the tutoring, I realized that we would need to depend on our partners at North Carolina A&T, and there's college students that need to be in school, need funds to stay in school at this HBCU, and North Carolina A&T graduates the most Black engineers in the world. So they have lots of African Americans who have a background in math and science that could tutor our students. So we formed a partnership with them to pay their work study so that they could come into our district and tutor our secondary students. And you raise a good point about how do we train our teachers? And it made me think about how prepared teachers are coming in, and many of our teachers are not coming in, as I said, from the schools of education. But I learned that this model of pre-recording lessons and having teachers watch one another virtually, allowing one teacher to teach perhaps a team of students while others observe that teacher and support students, may be a way to use an apprentice model to better prepare teachers, because then they get a full year of working with some of the best teachers instead of just doing perhaps more university seat work and then 6 weeks of student teaching that feels sort of artificial. But now they get to observe the teaching in practice for a year. And I think that may be a more effective way. And we'll know more at the end of the year when we see the end of year results.
Thank you. We are at 1:59, so I'm going to close things up. And first of all, let me thank our panelists, Dr. Erin Parsons, Dr. Sharon Contreras, and Dr. Sonia Santelises for being with us today. Great discussion. Learned a lot. There are a lot more questions we could have asked you. I'm sorry we couldn't get to all of them. Thanks to the audience for your questions and logging on and participating with us as well. Please join us if you can for next week at 1 p.m., September 22nd, when we're going to be talking about looking toward the future. Can we build a Marshall Plan for education? What can we take away from this pandemic and how schools have responded, and what we need to do for a systematic effort at rebuilding our nation's schools. We're going to have a great panel next week. We're going to have Dr. Robert Slavin, who's the School of Education Distinguished Professor and Director of the Center for Research and Reform in Education, Rick Hess, who's the Resident Scholar and Director of Education Policy Studies at the American Enterprise Institute, and Professor Otis Johnson. Dr. Johnson is a Professor of Education and Sociology at Washington University in St. Louis. Thank you to the School of Education team that has made this all possible. And I look forward to spending some time with you next week, September 22nd at 1 p.m. Thank you.